Hello everybody, welcome back to our positioning class. Today we're going to go over the humerus. It's the largest bone in your upper body. It's the upper bone of your arm. And let's talk a little bit about the humerus. So the projections that we use when shooting the humerus are an AP and a lateral. Now, if the patient has trauma or a noticeably broken humerus, we're going to use some trauma views, which is just a normal AP and a transthoracic view, which is very interesting actually. That is the word of the day, transthoracic. What does transthoracic mean? It means going through the thorax, okay? And I'll explain that in a minute. SID, 40 inches, okay? So we're going to be shooting this at 40 inches. Suspended respiration on a normal humerus, so we'll just have them hold their breath. Central ray is the mid shaft of the humerus, and we can shoot these both supine, laying down, or standing up. Preferable is standing up. It's a little bit easier on us and the patient. Collimation wise, we want to be able to get the superior skin margins above the glenohumeral joint or above the shoulder. Inferior to include the entire elbow joint. Okay, both lateral and medial skin margins should be seen. Technique: KVP 65-70, mass 8 to 12 depending on the size of the patient. Okay, just a couple tips. If patients are in a lot of pain, allow them to rest their arm on their hip or their stomach. Allow them to be in a comfortable position. Whatever makes their arm feel better, and we'll just work with that. So at times, optimal positioning is not possible. Positioned by moving their body versus moving their arm. Okay? It's always better to move the patient's entire body versus grabbing their arm and moving the arm if they have an arm injury of any kind. We have to get imaginative. We have to use angles, angling the patient, whatever we need to do to get the proper picture. Just make sure you're collimating well and that you're getting the entire humerus in the picture, both superior and inferior joints. Okay, so let's jump into the positioning part of this. We'll run through that real quick and then I'll let you go. So we've got Kate here today, and we've got Mikhail back as our videographer. Okay, so we're going to do a right humerus. Okay, this is the humerus right here. Now, we talked about the central ray being right at the mid shaft of the humerus. Okay, so we're a little high here. So we're going to come down a little bit, about right there. So we're mid shaft. Pull that way a little bit more. Okay, you can see the central ray coming down. Central ray is right there. Okay, now we've got about an inch above the shoulder. We've got about an inch below the elbow. Okay, that's what we want. Now, we can go ahead and turn our tube, our collimation box, to follow that humerus up. Okay, you'll note that we turned it this way a little bit. Now, we're a little under collimated. We can bring that in as long as we're getting the lateral and medial humerus. Okay, so there's your AP. Patient's hand is out in an anatomic position. I'm sorry. Okay, and note we're going to have both medial epicondyle and lateral epicondyle in profile. We want to be able to see right in between those. Entire elbow, entire shoulder, entire humerus. We're collimated well on the sides. Okay. And we are going to put a right marker in our light. Okay, so we know that's right. And we're going to shoot this, and it's going to be beautiful. We'll have Kate hold her breath, so she doesn't move that arm up and down when we're trying to shoot the X-ray. Okay, there's your AP. Move on to the lateral. Okay, lateral. We're just going to turn the patient's hand over. We're going to put the back of their hand against their hip. Kind of puts them in a chicken wing. But you'll note that we are coming through this condyle, out that condyle. So they're going to be superimposed over each other, okay? We've got a little bit of distance between her and the image receptor, and that's okay. We're just going to have a little bit of magnification. So now on this, again, we're going to be mid-shaft, the humerus. Okay, we're going to open that up a little bit. We're going to turn our collimator box so that it follows the humerus up. Okay, we're going to move K just a little bit that way. Okay, okay, just make sure we're lateral on the elbow. We've included elbow, and we need to come up a little bit so we can include shoulder. We got light up here, light down here. We've got light here and light here. Okay, so we are in freaking good shape, right? Okay, we're going to pick our marker off the ground. We're going to put it on the collimator or the IR. Okay, there's your lateral, guys. Pretty simple, right? Okay, now say Kate comes in and we can see that her humerus is in bad shape. Okay, normally they'll be holding their arm just like that, maybe holding it with the other hand. Okay, now this is a trauma series for a humerus. Okay, that thing is so stiff. Okay, I'm just gonna move them. So our central ray is mid shaft, a little high here. Okay, now we've got light here, and we can see that we've got the medial humerus. Okay, we've got the elbow joint is well seen there. Okay, and we've got light above here. Okay, so this is a trauma AP. Now looking at it, you know that that's not going to be a true AP, right? But we're just trying to get a picture of the humerus. Okay, so we're not going to be moving that arm around just because they're in a lot of pain, right? So we're going to shoot it as is. Okay, this is our AP. Now here is our word of the day. We're going to do a transthoracic lateral humerus. Okay, we're going to turn Kate. Okay, she can keep her arm there if she would like. That's fine. If she can, you can move her hand back a little bit so their arm is up against the image receptor right here. Okay, make sure she's in a good lateral position. Because what we're going to do is we're going to shoot through Kate's chest, and we're going to look at her humerus through her chest, which is pretty sweet. Okay, we're going to bring Kate's arm up, just like that. Okay, now our collimation, you know, is what is helpful. I need to go back just a step here. Is if we can center that central ray right on Kate's humerus, mid shaft, because we're going to go through to the other one, and they're equal. So she is in the lateral position. So we know when we move that arm up out of the way, it's going to be in the right place. Okay, so we're going to bring her arm up. Whee! Good job. Okay. Now we're plenty high to get the top of that shoulder. We're going to get the bottom as well. So now, and we know we're in a good position because we actually position that arm. It's going to be the same as this arm. Okay, we're going to keep our marker there. So now the different part with this picture is we're going to use a breathing technique. Okay, so the patient is going to remain breathing. Nothing special. Just taking breaths, and the reason we do that is we're trying to blur the ribs out, and doing that we need high mass. Okay, I'm talking 55, 60 kVp at 400, 500 mass. Okay, we're kind of maxing our machine out. But what that's going to do is that's going to give us some time. It takes about a second to shoot this. Okay, and that second, it's actually going through Kate's chest, through this humerus, the affected humerus, into the image receptor, and it takes a whole second. Okay, and in doing that, we're blurring the ribs out. Okay, those ribs are moving because she's breathing, right? So the picture is actually really neat. So we actually took a test picture this morning, and it turned out really good. We shot it at 55 at about 450 mass, and it looked really good. We should show you, but it's not up. I'll bring it up next time. But anyway, you can see where the ribs are blurred out, but you can see the opposite. You can relax. the opposite humerus really well, And that's what we're going for in a trauma situation. Okay, but that is humerus. Very funny. That's humerus. Anyway, that's how we shoot a humerus. AP lateral. Long bones are just 2 views, AP lateral. Trauma is just a little bit different, just a little variant. But watch this video and figure out how to do it. And if you ever have a chance to do it, give it a shot. So my questions for today is, what's a good joke? Let's see. Why did the chicken cross the road?
Oh, okay.
And the answer is to get to the other side. But it's humorous because we're doing a humerus, right? Not that humorous, but just a little bit. Okay. And it's snowing in Evanston today. Really hard, actually. So that is our second question. Is it snowing in Evanston today?
What's the word of the day?
Oh, what is the word of the day? It has to do with a thorax. Okay. Anyway, thanks for coming. Thanks for stopping by. Thanks for watching. We'll see you on the next one. The next one's going to be clavicle, and it's going to be sweet. So we'll talk to you later. See you guys. Bye.